Don't we always wonder why so many people are taking vitamin D, yet you don't hear the full benefit of vitamin D is spreading around the world? Because the answer is obvious. Many companies, majority of companies use synthetic vitamin D, which actually deposit calcium into the blood instead into the bones. And that's why at lookandvibrant.com we use raw vitamin D3 vegetarian form, and we add K2, which is MK7 full spectrum, to help deposit the calcium into the bones and out of the heart and the arteries. Here's a brief video about one of the latest vitamin D3 benefits.
I'm looking at a new study today from Canada, just published in March 2023, and it shows that people that take vitamin D supplement get about a 40% protection against dementia. Now, a few weeks ago, we looked at people taking vitamin D supplement get about a 15 to 18% protection against people that have pre-diabetes developing diabetes, and that applies to about over 90 million people in the United States, so a huge difference. And here we're seeing that there's a 40% protective effect in this study against developing dementia, particularly Alzheimer's disease. And people that are likely to get diabetes are likely to get dementia, so it just seems to make perfect sense to give these people extra vitamin D. Now, here's this study here. So the blue line is people that had vitamin D, and the green line is people that didn't have vitamin D, and these are people that survived without getting dementia. So we see a clear difference, and the study was done over 10 years. So we see that people that had no vitamin D, fewer of them survived without developing dementia. So it's an absolutely huge effect from what is essentially an interventional study. So let's look at it now. Vitamin D supplementation, and we'll look at some of these other things in a minute. A diagnosis and assessment and disease monitoring journal, peer-reviewed, Alzheimer's Society of Canada, published from Alberta. Now, there's been known associations in the past with vitamin D and dementia. In other words, people with low vitamin D levels are known to be getting more dementia. But it wasn't known whether it was a correlation or whether it was causal. This shows that it's very likely to be a causal correlation, that giving vitamin D protects against dementia. So the role of supplementation was unclear, but this does clarify. It's a prospective study, and as we say, it's longitudinal, so it goes on for 10 years. Now, that's a really good study length, and we can see the gap is increasing. The protective effect of vitamin D is increasing over the 10-year period. Now, there was 12,388 patients dementia-free at the start of the study, so a pretty good number. 12,388 from the National Alzheimer's Coordinating Centre sorted out that in Canada. So people that took vitamin D were called D positive, and people that didn't take vitamin D were called D negative. And they wanted to see what the difference was over this longitudinal period. And as we noticed, as time went on, the benefit just seemed to carry on increasing. So we've got a benefit there after after about a year. So taking vitamin D for about a year, and then the gap just goes on increasing, with fewer and fewer people surviving here without dementia as time goes on. The p-value there is very significant. P equals 0.0001, so very unlikely to have arisen by chance. And the average age in entering the study was 71 years. So again, people that are at a risk of diabetes as well as dementia could benefit from this. Mild cognitive impairment and depression were both more common in the D negative group compared to the D positive group. In other words, people taking vitamin D had less mild cognitive impairment and less depression, consistent with data that we looked at from Ireland a few months ago, or last year, whenever it was.
So basically, we can see clearly here vitamin D was very effective, but also remember, it was after 1 full year of taking vitamin D. So don't expect any results in the first 2 or 3 or 4 months. and especially in places like that are more with cold weather and long winters. So you might need longer time to get the full benefit of vitamin D3 if you're taking it daily. Some people think 2,500 IUs daily is enough. Some people want to take 5,000 IU daily is at least for them to have proper dose. Some people even go up to 10,000. So it's best way is to just ask your holistic doctor or nutrition expert regarding this issue. Good day.